Hello, my name's John Leach. I'm the chair of the Stockport LInk. I have been a member of the Stockport LInk for 2 years now, in which time we've done an amazing amount of work, thanks to the work of our managers and our lovely, lovely people. I became involved with LInk because basically I'd retired from my work and my partner said, I don't want you indoors messing about and hanging about here under my feet, go and find something to do. I looked around, and as I've always had interest in health issues, I thought that LInk would be a good thing to join. Here I am. I'm surrounded by people who all have the best interests of the community at heart, and as such are prepared to work on a voluntary basis to get things organised for the benefit of their fellow members, fellow people in Stockport. We're working very closely with the Stockport Council and their various departments, also with the members from Stockport Hospital and various other departments to do with podiatry, dentistry, pharmacy and everything else to do with the health service are involved with. We are working also with Stockport NHS, which is the new version of the PCT, is that right? Yeah, good. Over the last 2 years we've made great strides in improving various little things that happen in Stockport that annoy the residents of Stockport, such as a great advancement made in hearing aid. The time that was taken to repair hearing aids was over 16 weeks. Now, through our work mostly, we managed to get that repair time down to 2 weeks, which is a great advance for the people who rely on hearing aids.
Stockport LInk was established on the 1st of October 2008, which makes this October coming up our second birthday. Since the LInk was set up, we've done many things, and I'll let our LInk members tell you what we've done in the last year.
Undertaken 21 enter and view visits carried out by Linker enter and view authorised representatives.
Attended or hosted 42 public engagement.
Made 26 requests for information to health and social care organisations.
Commented on 9 policies, strategies or relevant documents relating to health and social care. Took part in 4 pieces of research.
Provided 30 class presentations and talks to local groups to promote the LInk.
Took part in 5 areas of joint working with other agencies.
Received 12 requests to join strategic groups. Took part or hosted 11 focus groups.
Received over 100 feedback forms for health and social care services.
Written 23 articles for partner publication.
Celebrated its inaugural year at Stockport Art Gallery with 60 people attending.
Everybody in Stockport will at some point of time be involved with the National Health Service and the social services, and therefore everybody will have an interest in watching how these services are provided for us. Many people also have a lot more experience of this and have a point that they wish to make, the sort of point that the provider of the service ought to hear. Because some of us are so busy, and because we haven't got much time or the ability to put this into the words that we would like to and pass it on in the way we should, we need the support of some sort of organisation that will help listen to what we say and help us put our views either individually or collectively to the right people. LInk does just that. And as a member of LInk, I feel a main part of my responsibility is to listen to people and to make sure that I understand the points and arguments that they're putting forward, both on the good things and on the bad things that are happening in the area, in the hope that we can change things for the better in the future. In my own personal role, I do my best to represent the residents of Stockport on one of the important committees within the Stockport Primary Care Trust. This is the Community Health Stockport Committee that runs the district nurses, the provider side of the primary care in Stockport. And I find this very interesting, and I'm delighted in the way that the people round the table there are able to listen to the views, and do listen to the views that I've been able to express. And I have considerable freedom in what I say in that, and can do so without any constraints put on me or pressure put on me by the rest of that committee. There are other people in the LINK organisation who are represented on other boards in the community, and this is becoming increasingly important as there are primary care trusts in particular does develop the various strategic boards for key policies into its areas. LINK is also on the Health and Wellbeing Partnership, which together with other people within all Stockport and particularly the council are agreeing the priorities in the area.
As you can see, current LINK members are involved and are working with the statutory sector to address issues and areas of concern to local people in Stockport. Notably, a couple of the areas the LINK is currently working on, based on feedback from LINK members and members of the public, is that of discharge experience from hospital and that of accessing your GP. The LINK has set up a discharge from hospital task and finish group, aiming to understand the processes around discharge and the experience of people leaving hospital. The group has designed a questionnaire to provide us with the evidence to present to commissioners and providers involved with patient experience. The Stockport Health Care Forum, an ongoing subgroup of the LINK, has taken up the issue of using your GP surgery and people's experience of using that, and has also designed a questionnaire so they can target the specific aspects of using GP services which need highlighting to commissioners and providers of services. If you'd like to tell us about your experience of either discharge from hospital or about using your GP surgery, you will find surveys and questionnaires on the LINK stand at the back of the hall. Results of both the surveys will be available later on in the year, so be sure to sign up for our LINK newsletter to keep up to date. Looking to the future and the opportunities provided to us from the change in government, and there are opportunities, as a network we have strong relationships with organisations and services which address the needs of different sections in the community, but we do acknowledge that there is more to do around children and young people, and are currently in the process of setting up a Young People's Health Forum in Stockport. We're doing this in partnership with Action for Sick Children, Stockport Council, NHS Stockport and the Foundation Trust. We hope that young people here will take the lead, and we are committed that they have a voice and they are empowered to use it. I'm sure today will inform some of our future work at the LINK, and the LINK will continue to monitor services to ensure that the priorities identified today are taken into consideration. We hope that today will go some way in strengthening public engagement and involvement, and we will ensure local people are at the heart of decision making in Stockport. Have an enjoyable afternoon. Don't forget to sign up for the issues you're interested in, and I think lunch is just about ready. Take care.